One of the well-known psychologists of our times, Feldman, in the Journal of Basic and Applied Psychology, published an article about how we lie. In his paper, he has said that 60% of people during a 10-minute conversation tell one lie at least. An average human being tells about 2 to 3 lies during a day. But these lies are usually innocent lies, innocuous lies, they do not harm anyone. These are like the lies of Pinocchio.
Pinocchio, why didn't you go to school?
Every time he lied, his nose got longer and longer and longer. But we are not talking about these lies. These are innocuous day to day lies, and every one of us is used to it, and we do not care too much about these lies in day to day living. But what affects us most is professional lies. Since we are talking about hair transplants and hair loss, this field is extremely competitive. And when the field is very competitive, almost cutthroat, these lies abound. So the purpose of this video is to take you through the commonest lies that are now almost firmly ingrained in the psyche of the patient who is researching a hair transplant. What happens with a lie which is told frequently, again and again, if you tell the same lie, the person who's telling the lie starts to believe in that lie. He thinks that's the truth. And the person who's hearing that lie again and again on social media, on radio, on television, starts believing in it. So lies perpetuate themselves. They perpetuate themselves so much that you begin to feel that it's the truth. So that is what is the basis of this talk, to tell you about the 50 lies that have perpetuated themselves in the hair loss industry. Is hair transplant for everyone? No, hair transplant is not for everyone. Everyone does not have a donor area that is good enough for a hair transplant that will last a long time. A hair transplant may not meet the objectives, the goals of a patient. So a hair transplant is not for that person. A hair transplant might not satisfy your irrational goals. So hair transplant is not for you. Hair transplant has its limitations. Out of every 10 people who walk into my outpatient department, only 3 people are fit for a hair transplant. Hair transplant is merely for filling in bald patches. As new bald patches continue to occur, we continue to fill them. Hair transplant does not stop baldness. It does not stop the onslaught of androgenetic alopecia, which is genetically determined and which we cannot predict. So hair transplant definitely does not cure your baldness. Yes, it gives you relief from your bald patches, but when these bald patches continue to increase in size, you need more hair transplants. Hair transplant cannot be done at any age. There is a limit. There is a lower limit to it. A hair transplant in most cases is not done before the age of 25. Why? Because the donor area is not mature. It is not stable. So when the donor area is not stable enough, we are not sure how it will behave, how the grafts which have been lifted from this donor area and transplanted into the bald recipient area will behave in the times to come. Because if we do a hair transplant at say 22, and by the time he is 25, the donor area begins to thin. So those transplanted hair which we transplanted at the mere age of 22 will also fall off when the donor area begins to thin. So transplanted hair mimic or are a mirror of the condition of the donor area at the back. So they will behave exactly during their lifetime as the donor area at the back behaves. If the donor area begins to thin later on in life, these grafts will thin and perhaps also fall off. Hair transplant results of 2 different people will never be the same. There are so many variables in hair transplant, in hair growth, the objectives of the patient, in the hair quality, the hair growth potential of a person, whether the patient has taken DHT blockers or not. So if you see images on a website, or if a doctor or a clinic is showing you images on their website, so it is not that you are going to have a similar result. Yes, You can get a broad perspective of how hair grows and how hairlines do form and how thickness can be achieved. But your hair transplant result will most likely not match what you are aiming for. We do not yet know the quality of your hair. We do not know your growth potential. And there are so many factors which are there in the healing process. One of the biggest lies going around in the Indian hair transplant industry is get your hair transplant before it's too late. If you give it a deep thought, if you get a hair transplant at an early age, it is not going to cure your baldness. It's only going to make matters worse because at an early age, say before 25 years of age, if you get your hair transplant, the donor area is not yet stabilized. We do not know the integrity of the donor area, whether it is permanent or it's non-permanent. So if we were to transplant these hair to cover the bald area in a person less than 25 years of age, it will only make the hair fall off if the donor area proves later on at the age of 25 to have been unstable. This statement, get your hair transplant before it's too late, is pure solicitation of the patient and perpetuating a lie. Hair transplants are often said to last forever. But between the ages of 55 to 65, overall generalized hair thinning starts to happen. And because the transplanted hair are at a lesser density, they are just an illusion of density. Once this thinning hits them, the result peters off. It seems as if the patient has lost those hairs, which he has not. They've merely become thin. But because the density was just about 30 to 40 to 50% of natural density, it begins to look bald. So though hair transplants are permanent, but the illusion of hair transplant is maintained only till generalized thinning of hair. Transplanted hair only need care till 6 months. During their growth phase, they are susceptible to DHT because no hair is completely DHT resistant. So when the grafts are in the growth phase, they are likely to be affected by DHT, which can stunt their growth or even prevent them from growing. So this umbrella is provided by DHT blockers during this period of 6 to 9 months, after which, once the hair are in full bloom, they are permanent. They do not need any extra care. Yes, if your donor area begins to thin, or if your grafts have been harvested from a non-safe zone, that is a non-permanent zone, yes, there is a cause of concern and you have to restart DHT blockers if you do not want to lose your hair. So generally speaking, transplanted hair do not need any special care after 6 months are over following the hair transplant. Hair transplants are both for men and women. Only women suffer hair loss, not as commonly as men do. In my clinic, for example, out of 100 clients, 97 clients will be men and only 3 clients will be women. There are 2 reasons for it. One, that women do not bald so much as men do. And secondly, when women bald, some of them bald so much that their thinning is not only over the top, over the hairline, over the vertex crown area, but also their donor area begins to thin. So grafts cannot be harvested, so they are not candidates for a hair transplant procedure. So therefore, this has given fuel to the rumor amongst women that hair transplant is not for women. Hair transplant is not a procedure in which you will get results immediately. This lie is being perpetuated by people who do long hair transplants. Hair transplants, once done, the hair will shed. In a majority of patients, 95 to 97% of patients, 67 to 80% of the hair will shed within 4 weeks and 6 weeks. Hair begin to grow only after 4 months. It's only after 6 months that you start seeing a result, which in some patients, in slow growers, can be between 9 months to 12 months. As long as you are free from disease, free from systemic illnesses like diabetes mellitus or heart problems, as long as you are healthy, you are fit for a hair transplant. Of course, if you meet the general requirements of a hair transplant. But If you have diabetes, if you have a heart problem, it should be under control. Diabetics should have an HbA1c level less than 6.5 to 7. Your heart condition should be such that anesthesia can be given to you. If you are taking blood thinners, they need to be stopped 1 week before the hair transplant, and they can be resumed shortly thereafter. So, upper age limit is not a criteria for a hair transplant. Hair transplant, if done in a center which has all life-saving measures, and it has a person who can deal with emergencies in attendance, is a very safe procedure, because anaphylaxis, which causes problems, happens in very rare instances. The problem happens only when we choose a clinic due to various compulsions and allurements where this infrastructure does not exist. And if anaphylaxis happens, there is nobody there to treat it, because the doctor who's doing your hair transplant or the technician who's doing your hair transplant is not qualified enough to handle such an emergency. The other complications that can happen are like scalp necrosis, because the doctor does not know how much of anesthesia to inject into the scalp. He does not know the basics of skin management. He does not know the basics of wound healing. So scalp necrosis, when it occurs, can be a huge disaster. There have been instances of loss of eye and even death. So these are all instances that have happened when there was no adequate supervision. If you research these instances of deaths, loss of eye, scalp necrosis, you will find that this has happened only in clinics which throw caution to the wind, and there is no direct supervision by the doctor or any other person qualified enough to supervise such emergencies. The density of youth, the density of adolescence is only specific to that period of your age. As you begin to age, when you move from adolescence to adulthood, your hair volume, your shaft diameter continues to decrease. Well, this is normal. Many people interpret it as balding, thinning. It is not. And if you seek a hair transplant and there's a hair transplant clinic which is ready to oblige you, it will not be in your interest, because making incisions so close to existing hair will damage your existing hair, and the result will be far worse than your pre-existing condition. In hair transplant, we are dealing with living tissue, biological tissue. It is not that you can keep adding density to as much level as you want. But this is happening, and that is the reason for this video. More the grafts, the better the result.
Oh, look! My nose! What's happened?
Perhaps you haven't been telling the truth, Pinocchio.
This statement is so untrue. Firstly, because when you're giving more grafts, it decreases the chance of survival of the grafts. There is an optimal density per square centimeter. If you exceed, the graft survival becomes low. And there is a density when you surpass. There is an all or none phenomenon which comes into place. You may also lose all the hair. Secondly, putting a lot of grafts in a given area plays havoc with your future goals and objectives, because baldness is going to progress further and you're going to soon run out of the grafts. So therefore, the more the grafts, the better the result is a wrong statement. Hairlines are specific to your type of baldness. Hairlines are specific to your age. Hairlines are also specific to your profession. Suppose you are a celebrity. For you, a hairline means a lot. You have a fixed number of years in front of the camera, and that's the only thing that is prime in your mind. A hairline should look natural. As one ages, one should grow into your hairline rather than growing out of it. One hairline that suits a particular person may not suit the other person, because there are so many variables that have to be taken into account while planning a hairline, which is discussed in other videos. Now, this myth that transplanted hair look unnatural is born out of several bad cases that are now very commonly seen, because hair transplant is increasingly more acceptable and is increasingly more sought after. So when you're out in the street, you see so many bad results. From a distance, you can make out that a person has got a hair transplant done because it looks so unnatural. So these hair transplants, which can be made out from a distance, do tremendous disservice to the profession. A good hair transplant is one in which even the barber might not be able to tell. Natural hair transplants are today possible because of magnification, because of newer techniques of implantation, and a better understanding of hairlines, of hairline design, of utilization of hair in different areas, and of strategic placement. Just because kidney transplants, corneal transplants are possible, that does not mean that hair transplants can also be done in individuals. Hair transplant is a cosmetic surgery procedure. It is not a life-saving procedure. In a kidney transplant, the patient has to be put on several months of immunosuppressants. He has to be hospitalized and has to be isolated for this period of time for a kidney transplant to succeed. How many of you will be ready to do that for a hair transplant? So this idea is very far-fetched. Hair transplant utilizes only your donor area and nobody else's. So hair transplant donors do not exist. A hair transplant is a very safe procedure if adequate high quality equipment is used. Well, if you go to a cheap clinic and they use cheap instruments which go deeper than the depth they are meant to go to, they can damage underlying vessels, underlying nerves rampantly. When vessels are damaged, your face balloons out, it swells so much. But when nerves are damaged, the effect is long lasting. When a nerve is damaged by a sharp instrument, whether completely or partially, you have what is called as neuroma formation. That is a bulbous swelling which occurs in order to heal the nerve. And this can be very painful to touch. It can be painful even otherwise to various stimuli. And it can last a long time. The problem here is that it is very difficult to treat. Why? Because it's not possible to localize so many neuromas. And treating so many neuromas is a Herculean effort. So I have seen 2 or 3 such cases which are very debilitating and are being treated by injection of Botox. In a clinic which does minimally invasive procedures, these complications are never seen. Now I'll just give you an example. You go to a nursery, you get a plant from there, pick it up with the root and bring it to your garden and plant it. Now since it has been uprooted from the nursery with the root, it will not grow back in the nursery. Unless of course it is a rhizome. So similarly in hair transplant, the root does not replicate. Once the grafts are lifted, new hair will not come up. It cannot come up because there is only one root to one hair. So the donor area, once depleted, is permanent. So this is the limit of hair transplant. If your hair transplant fails, those grafts are lost forever. So you are then limited by available grafts in the donor area. Roots do not multiply. The brain is not affected by hair transplant. Even in the worst of worst instances, it cannot be affected. Why? Because the skin thickness itself is 1.2 centimeter. And then you have the bone, which is almost like 2 centimeters in thickness. And deeper to the bone are the meninges, the outer coverings of the brain. So the brain is very, very far away, almost like 5 to 6 centimeters away from the depth to which you put your hair. And there is a strong barrier, the calvarium, the bone, thick bone of the head, which is only possible to breach by means of a trephine. And that's not what we use in a hair transplant. Yes, bad swelling of the face happens if the procedure is not minimally invasive, if adequate instruments are not used, if vessels under the skin are damaged. These vessels, once injured, the blood seeps down into the face and it causes a swelling of the eyes, of the face, of the cheeks, of the nose, which can be quite distressing and can last up to 1 month. But this is not usual in clinics which are using adequate, safe protocols and good equipment. Hair transplant procedures are not painful if the technique of anesthesia is good. if the anesthetist is in attendance. There are patients who are hyper anxious. Even with a little bit of painful stimulus, their brain translates it into a huge stimulus of pain. These patients need to be sedated. So you have to have the wherewithal, you have to have the facility for sedation in your clinic in such cases. Most patients very well tolerate the local anesthesia process. When I'm giving the anesthesia, most of the patients are talking. They're talking about themselves, about their experience, about how they reached us, and so many other things. So mostly we give local anesthesia in such a way that the patient does not feel any pain. The local injection discomfort is such that it is barely perceptible and it lasts only for 1 to 2 minutes during the injection phase, after which the whole scalp is numb. So hair transplant anesthesia is not painful. Even after the hair transplant, it is not a painful procedure because the hair transplant anesthesia lasts for about 10 to 12 hours. Most patients go on a holiday the very next day after the hair transplant. In a previous video that I have done on crown coverage, it is very clearly mentioned that hair grows as well in the crown as it does along the hairline. It is only because hair transplant is an illusion that the result along the hairline is not as apparent as it is in the crown area. In that video, I have also told you why this happens. Along the hairline, you can see hair one behind the other, and it creates an illusion of density. Whereas the crown area is seen end on. It's like if you see a forest standing level in front from the road, it looks very dense. The moment you climb up a hill feature and look at the same forest, it will not look so dense. It is the same thing that happens for the crown. Also, the crown is not planted in the same density as the hairline is planted for obvious reasons, because the hairline is first priority in most cases. The crown has to be planted in lower density because the crown continues to expand centrifugally. So when the perimeter, when the surface area of the crown continues to increase with age, and if we've planted in the center with very high density, and when we cannot replicate the same density in the peripheral areas because we've run out of grafts, it will cause a halo effect. This halo effect will look so unnatural. It is also referred to as the island effect. So to keep the patient's future baldness development in mind, we do not plant with as high density in the crown area as we do in the hairline. So that is why it has given rise to a misconception in the minds of people seeking a hair transplant that crown area results are not similar to those of hairline, which they are not.
Every single word.
After a hair transplant done using FUE technique, you can return to office the very next day with certain restrictions. You cannot bend your head forward, you have to wear a cap or a bandana for about 3 weeks. For 2 weeks, the head looks dirty because of crusts. After the crusts start falling off, after 2 weeks, you can go bareheaded indoors, but when you're going outdoors for another 1 week, you have to wear a cap or a bandana. So there is no restriction of when to join office. You can join office the very next day in FUE hair transplant. This is not true for an FUT hair transplant. Why? Because FUT hair transplant is a proper surgical procedure. A chunk of tissue from the back of the head has been removed, and it does continue to cause a little pain, a little discomfort, for which you should be at home for about 1 week, because you cannot bend forwards. If you bend forwards, if a suture breaks, firstly you'll have a lot of pain, and secondly there could be bleeding. So in FUT hair transplants, it is recommended to rest at home for about a week. And there are restrictions after a FUT hair transplant for 6 to 12 weeks, restraining from forward bending, and so many other restrictions as well. But in FUE hair transplant, you can return to work the next day with some restrictions. The safe donor zone, as discussed earlier, is considered permanent because it is relatively DHT resistant. It is not affected by the baldness process. However, this is not wholly true. All hair in the body in a person suffering from androgenetic alopecia are minimally responsive to DHT. The hair in the donor area are relatively DHT resistant. As you grow in age, the hair begins to thin. The hair density in the donor area begins to decrease. So this is proof of the fact that hair in the donor area are not completely DHT resistant. A hair transplant in most cases is not a one-time event, especially in patients who have extensive baldness or who have signs or family history of extensive baldness will require 2 to 3 procedures in a lifetime. Only very few patients who have a high forehead, who have traction alopecia, but do not have androgenetic alopecia may require only one procedure. But a vast majority of patients, especially those reporting at a younger age for a hair transplant and are likely to get extensive baldness, need 2 to 3 procedures.
Oh, please help me. I'm awful sorry.
Since donor areas are not completely DHT resistant, the hair once transplanted in the growing phase are very susceptible to DHT. This susceptibility lasts for about 6 months while they are growing. If we do not take finasteride, the growth potential can be less. It can be up to 65% only. Well, there have been patients who have on the quiet not taken finasteride and have had lush growth and have come back to me and said that we didn't take finasteride. But that is a very small minority of patients. If a doctor or a clinic tells you that you need not take finasteride, this statement of theirs is suspect because they're merely playing up to your fears and your anxieties and wanting you to just sign up for the hair transplant. Wherever you do your hair transplant, it is not the assurance of that doctor that if finasteride is not required that matters. Wherever you go for your hair transplant, your body will behave in the same manner, whether it is my clinic or clinic B, clinic C, clinic D. It is going to behave in the same manner. It is not going to behave as per the assurances given by the clinic that finasteride is not needed. Finasteride is a relatively safe drug. If it weren't safe, we wouldn't be prescribing it to you. If it weren't safe, it would have been banned long time back. We are giving you finasteride in your best interest so that you have a good result. We don't want you to have erectile dysfunction. So a clinic which gives you an assurance that finasteride is not required is merely playing up to your emotions, to your fears and your anxieties, and is only soliciting and wanting you to just sign up. Only 1% of patients on finasteride will have some amount of erectile dysfunction, which when you stop taking finasteride will subside. The vast majority of patients, almost like 99% in my practice, do not complain of any problem. And since the benefits of finasteride far outweigh its remote possibility of a side effect, it is very wise to take finasteride because you only have a finite amount of grafts in your donor area. If you lose 35 to 40% of grafts, it is not a wise thing to do when the drug is relatively safe. Yes, if you have side effects, you are at free will to stop it, being mindful of the loss that you might incur in the graft number that have grown. Most of my patients are taking finasteride, and most patients are taking for a long, long time. The President of the United States has been taking it for 25 years. And there's not a man on earth who's more virile than the President of the United States today. So it is a safe drug, and you should not hesitate in following your doctor's advice, which is given in your best interest. The more you read about finasteride on the internet, this information gets ingrained in your mind, and your mind rules your body, and your libido is controlled by your mind, and you will definitely have psychological erectile dysfunction. So that is why you should stop searching, follow the advice of your doctor in your best interest, and take finasteride merely for 6 months. That's the least you can do. People who are fearful of finasteride also assume that finasteride, when applied topically, that is locally, through sprays, through lotions, through foams, is as effective as oral finasteride. Let me tell you, finasteride does not cross the skin barrier well. The skin levels of finasteride do not match up to the levels which are achieved by oral finasteride. Well, I have done a video on it, and the video is in the description below. Topical finasteride is of no use. Topical finasteride is just a waste of money. Use of topical finasteride is escapism at its best. Well, a topical cream is being developed and it should be out in a year or two. But till then, the oral finasteride is the gold standard treatment for hair regrowth after hair transplant. PRP is so widely advertised. If you search PRP on the internet, there are so many clinics offering it in your neighborhood. But PRP has no scientific basis. PRP is not a DHT blocker. Giving PRP after a hair transplant in lieu of finasteride is a gross injustice to the transplanted hair. PRP is good for graft storage. PRP is good for thinning hair if done repeatedly because the effect is short lasting, but it is not an alternative to finasteride. If you have so many reservations about finasteride and you want to make up by using topical solutions of finasteride, by using PRP, it's like an ostrich burying its head in the sand, knowing fully well that finasteride in its oral form is the best drug to use, but having an escapist attitude that the grafts will not be harmed. If you are ready to take the risk of 35 to 40% loss of grafts, you are most welcome, but keep it in mind that the grafts lost do not grow back in the donor area.
You see, Pinocchio, a lie keeps growing and growing until it's as plain as the nose on your face.
Minoxidil is effective anywhere. Anywhere where there is balding, minoxidil will be of help to you. Hairline needs very dense quality hair. This is not possible by minoxidil to get very, very dense hair along the hairline. Therefore, this misconception that minoxidil does not work in the hairline. No surgical procedure is scarless. FUE or FUT, whichever procedure you choose, both create scarring. In FUT, since it is a linear wound, it is a long wound which is closed surgically, may lead to a wide scar if there is tension or if the scalp is tight. So this wide scar can be visible through existing hair, especially if the hair in the donor area are cut very short. In FUE, if the case has been selected well, and if over-harvesting is not done, harvesting is done only in the ratio of 1:5 or at the most 1:4, 25% to 30%, the scars of FUE are barely perceptible even when the head is trimmed very close. So this is a big advantage of FUE, that these scars are pinpoint scars. They are usually not visible. If over-harvesting is done, if you take too many hair from a particular site exceeding the 1:4 ratio, then it may cause patchy scarring. But that is not what good clinics which do FUE routinely will offer you. So scarring is universal. Wherever there is surgery, there is scarring. The trick is to make the scar imperceptible so that in normal circumstances, the scar is not visible. Laser, that is light amplification by simulated emission of radiation, is said to increase hair growth. It is not untrue that laser will not cause hair growth. It will cause hair growth. Anything which increases blood supply to the follicle will for some time cause the hair to grow. It could be any external physical stimulus like laser. It could be like micro needling or so many other things which are in vogue today to cause physical stimulation of the hair follicles. But laser does not have any scientific backing. Use of laser in hair loss is not scientifically proven. Laser is not a substitute for hair transplant. It is not a substitute for finasteride. Laser is popular because of intense marketing by laser companies. Many times you go to a clinic and they will say that you need about 3,500 grafts for your grade 4 pattern baldness. But if you want to future-proof your scalp against balding, which will happen in the years to come, we can add another 2,000 or another 2,500 and make the total go to 6,000 grafts. So when your balding happens, it will not be noticeable. So this is a trick only to increase the number of grafts. Future-proofing is not possible to know where the baldness will progress, whether you will progress towards baldness also or not. Sometimes thinning is noticeable. You think that this area is going to bald, but for 5, 6, 10 years, nothing happens. The hair remain the same. If you take finasteride, the hair quality of that area will improve significantly. So future-proofing is a waste of grafts in the wrong direction because no one knows how you will progress, whether you will progress at all. So this is just to caution you. Body hair transplants have come as a boon to the hair transplant industry, and it was made possible by FUE hair transplant. Ever since body hair transplants came into vogue, greater number of grafts can be harvested. Cases which were earlier not possible to be given a head full of hair can be done proper justice to today, because the body will allow so many grafts in the proper selected patient to cover additional areas. Body hair transplant is very common from only two donor areas. One is the shadow area of the beard, and number two, the chest. Other areas have a life cycle that is very long. The result, if at all, will come only after 2 to 4 years. And secondly, the hair in those areas are so wispy thin. A little bit time out of the body, they will dry up and die out. Hair from other areas other than the beard and the chest have a low survival rate. So when you want the doctor to cover your head with leg hair and arm hair and back hair, hair from the perineum, you have to make sure that this hair is thick enough. Thin hair is not going to create any illusion of density on your scalp. The other thing you have to note is that you have to have a significant amount of scalp hair to disguise the unique characteristic of these body hair once they are transplanted to the balding area. So body hair from any location will not work. The areas from where body hair works on a regular basis are the shadow area of the beard and the chest. It also works in those people who have very thick body hair. Well, in those cases, we can take hair from the belly and from the legs. But this is not true for everyone. Nowadays, there are so many companies which are advertising, especially in India, saying that they do laser hair transplant. Well, I have not heard of laser being used in hair transplant surgery. Probably they are talking about the planning of the hairline by using the laser beam. So you should inquire from the clinic, take more details. What is this laser hair transplant and where is the laser used? Because to the best of my knowledge, laser is not used for either harvesting or for slip making. I do not think that laser has yet any utility in hair restoration surgery. The robot in hair transplant has been now in vogue for almost like 10 years. However, the robot has its limitations. The robot cannot access certain areas for hair transplant. The robot is very cumbersome to use. The hair transplant clinics which are using the robot are not using it routinely. It is more as a marketing gimmick than as a useful tool in their armamentarium. Most of the clinics which use the robot are FUT clinics. Through advertisement, allurement of the patient to a new technique of FUE hair transplant, but finally convincing him into getting an FUT procedure. So the popularity of the robot is on the wane since the last 1 or 2 years. Even with its limitations, the hair transplant procedure with a robot is sold for almost 5 times the cost of an FUE procedure. Artificial hairs made of artificial fibers were in vogue about 12 years back. But in tropical countries where you sweat a lot, where the skin characteristics are such that it is very oily, and due to rejection of the foreign body, which is lying in the skin, it increasingly became very unpopular. There are so many cases, if you search, of people landing up with severe infection, with permanent scarring, which is at times grotesque, and therefore it went into oblivion. The last 3 to 4 years have seen a resurgence of artificial fibers for artificial hair transplants. I see so many patients, and so many patients send their queries to me whether they get their procedure done through me or from any other clinic. But I have seen only 2 cases which have had artificial hair transplant done, and both of them were complaining of infection. Artificial hair transplant through hair fibers is not a very common thing that is done. A person who gets lured into artificial fiber hair transplant usually regrets the use of this technique. Therefore, artificial hair transplant through fibers is not popular. If you are getting married in 15 days, 30 days, you go to a hair transplant surgeon and ask him whether you can get long hair transplant done. He will say yes, of course. You can have your wedding with a head full of hair, long hair, whatever length of hair you want. You will get a hair transplant so that you look completely natural. Do you even think this is true? The process of shedding is intrinsic to the biological nature of the process. Hair starts to shed in 7 days. And by the time it is 1 month or 6 weeks, mostly all the hair has shed off. Whether the hair that is transplanted is long or the hair that is transplanted is short, it is destined to shed. And this starts as early as the 7th day after hair transplant. Until 2 weeks, the hair looks so messy because the crusts fall off only after 2 weeks in most patients, that within 2 weeks, you cannot attend a wedding function. And if you attend a wedding function after 2 weeks, most of your hair have started to shed. So I personally do not see any benefit or any value to the patient through long hair transplant. It is merely one of the lies which is perpetuated and has become a myth today that long hair transplant is what you need if you have an emergency situation like a wedding coming up. So there is no merit in long hair transplants because long hair transplants do not meet the patient's aspirations. A patient who signed up for a long hair transplant would like the long hair of long hair transplant to stay and not shed, which is not possible and no doctor can assure it. The no-shave technique. Earlier, the no-shave technique was when you shave small stripes at the back of the head, which can be hidden with hair from above, and that was referred to as no-shave technique. Some clinics went one step further and developed their technique of not having to shave at all. That is, in long hair, they harvest their grafts. Well, this is very much possible, but the only thing is that in such cases, the transaction rate using FUE hair transplant will be high. Why? Because FUE is a blind process. If the hair is long, you cannot make out the angle of the hair shaft because you have to align the punch along the angle of the hair shaft, which can be made out only when the hair is about 1 millimeter in length. You are causing a lot of damage. Your transaction rates will go as high as 20 to 30%, which should be only about 2%. So no shave technique, which is propagated today, is a lie which is being perpetuated by some clinics. Hair transplant once done, you need to take DHT blockers for 6 months. After 6 months, for the transplanted hair, you need not continue. But for your existing native hair, which are thinning, because balding is an ongoing process and balding is not cured by hair transplant, you may consider to continue these DHT blockers so your further balding is not arrested but slowed down. Also, DHT blockers need to be taken in case of transplanted hair if after a few years the donor begins to thin, and as a corollary, the transplanted hair also begin to thin. Thinning happens which is innate to a person's aging, or if it happens if the safe donor zone or the permanent zone has been transgressed and you have taken grafts from the balding zone. So in these cases, you may like to protect your transplanted hair by using DHT blockers for a longer period of time. Otherwise, usually, transplanted hair do not need DHT blockers after 6 to 9 months. After a hair transplant, you cannot shampoo the next day. Your hair requires a particular care, a particular regime, a particular protocol of care, which is unique to the clinic from where you got your hair transplant done. In our clinic, we give you antiseptic shampoos, which you have to use for 2 weeks after the hair transplant. There are other clinics which require this to be done only for 7 days. So you have to adhere to this specific program for 7 to 14 days in your best interest, and only after that can you use normal shampoo and go under the shower. There are two things that you understand by stabilizing your donor area or your hair before a hair transplant. One is stabilizing your scalp donor without any medicines. You wait till the age of 25 to 27 to see whether your donor area is strong enough for you to go in for a hair transplant, or it is diffuse thinning, or the density is such that it will not be able to cover the extent of baldness in your case. So this is one stabilizing the donor by waiting till 25 to 27 years of age before you undergo a hair transplant. There's another term which is very popular with some clinics, stabilizing your hair loss by using DHT blockers like finasteride. Use finasteride for 3 to 6 months, let your balding slow down and then go for a hair transplant. Well, as I've described in an earlier video, that finasteride before a hair transplant should not be used. If it is used, it should be stopped 1 month before. Why? Because it is giving us a false impression that the donor hair are good in quality. When you move these hair into the recipient area and then after 6 months you stop finasteride, the condition of these hair will go back to the condition of the hair which was before the patient started finasteride to stabilize his hair loss. So if this patient wants his hair to be thick, he is committed to continue to take finasteride for the rest of his life, or the hair which is not stable, which has been stabilized by use of finasteride, will all fall off. So there is no merit in stabilizing your hair loss with finasteride before a hair transplant. Hair transplant is very affordable today. There are so many ways you can afford a hair transplant. One is through getting a loan and paying through EMIs, registering with your clinic on the waiting list roster. If there is a sudden cancellation, a person who's booked to get a hair transplant done, he does not reach the clinic, and usually the clinics know about 2 to 3 days before when the patient cancels because of certain reasons. So if you can make it to the clinic in 2 to 3 days, you get a heavy discount. And the third way to get a heavy discount is to get a procedure done during the months when work is slow. So these are the ways to get a discounted hair transplant at the clinic of your choice. Well, ever since I have come into hair transplant practice, and that's about 15 years back, we have been told, not only patients, I'm talking about ourselves as hair restoration surgeons, we have been told in every conference that cloning is 5 years away. Well, 5 years have passed and still it's 5 years away. So what can I tell you as a patient? Research is still going on. Permissions from government agencies to clone hair are still awaited. Scientists have been able to grow hair through cloning on rats, but that's what we've been hearing for last 15 years. So I do not think that during our lifetime, we will be able to benefit from the fruits of cloning. Well, thank you for watching, and I hope you liked this video on the lies that have been perpetuated over time, and these lies became myths. And do subscribe to my channel. Take care.